My name is Renaud Vaillant. I am the CEO and co-founder of Alaya.bio. Alaya.bio is a biotech company that I created in 2022 together with my partner in crime for the past 15 years, Cécile Bosch, the CSO of the company, and Michel Sutherland, our scientific co-founder, and who is one of the CAR-T pioneer and most likely a Nobel Prize winner in the next few years for his work on CAR-T cells, which is the topic of today. We have a team of 20 people based in Paris, plus an additional 3 people as part of the collaboration that we have with Michel. So Alaya is developing therapies to fight against cancer, and more specifically, we are developing immunotherapies. Unlike chemotherapies or unlike radiotherapies, which are targeting directly the cancer cells, immunotherapies will stimulate the immune system of the patient to allow him to fight against cancer or to fight against autoimmune diseases. More specifically, over the past few years, a new technology has revolutionized the treatment of some cancer, and more specifically blood cancer. And this technology is called CAR-T therapies. So what is CAR-T therapies and how does it work? So you have here a little schematic on the slide. And basically for CAR-T, you have to take a blood sample from the patient. You ship it to a centralized lab where you isolate the T cell, the white blood cell or the cytotoxic cells. And once those cells are isolated, you introduce a genetic modification to force the expression of a specific receptor specific to the cancer cells that you want to track and kill. Once this genetic modification is inserted, you force the proliferation of those cells to build a little army that will be reinfused to the patient. You are on the right part of the slide, a little cartoon that is basically presenting what CAR-T is. It's basically creating some super soldiers, and the red piece that you can see on the right hand is basically the CAR-T and the genetic modification that is inserted into the CAR-T cell. So it works pretty well with outstanding clinical results, but more than 7 CAR-T therapies that have been approved to fight cancer. But as you can hear, it took me almost a minute to describe you in length how CAR-T works. And what you can also understand between the lines is that behind this complexity, there is obviously a consequence in terms of cost of this kind of treatment, because this kind of treatment will cost approximately $500,000 per patient. At Alaya, we are developing a targeting nanoparticle to produce the CAR-T cell directly in vivo or in situ. And the objective is to produce faster, cheaper, but also better T cell. Faster, it's because we can replace a weeks-long manufacturing process by one systemic off-the-shelf administration of the targeting nanoparticle. Cheaper because you don't need the costly manufacturing facilities to produce ex vivo the CAR-T cell or to manufacture the CAR-T cell ex vivo. You have also a shorter and simplified supply chain. And better T cell because the cells that will be produced in vivo are de novo cells. They are not exhausted by weeks of expansion or weeks of overstimulation of the cells, and they are fresh cells that are able to track and kill the cancer cells. What is also interesting to note is that this in vivo strategy allows, and this is unique to our technology, but allows the redosing potential of the patient if the patient relapses or if the patient needs a maintenance treatment. So how does it work without entering into too many details? You have here a schematic of the targeting nanoparticle. In the middle, in light gray, you have the lentiviral vector. So the vector that is coding for the CAR, basically the same than the one that you use ex vivo to produce ex vivo the CAR-T cell. But this vector is further functionalized with some biopolymers, the red and the blue piece that you can see on this drawing, onto which a targeting agent is covalently grafting. And this targeting agent will basically act as a zip code to redirect once injected into the bloodstream of the patient to redirect the targeting nanoparticle toward the cells of interest, in this case, toward the T cells. So as mentioned, we have an active collaboration with Michel Sadolin, one of the CAR-T pioneer, and we started this collaboration when he was at Memorial Sloan Kettering in New York, and we are continuing the same kind of collaboration at Columbia, where he recently moved. Michel is responsible for the translational collaboration, i.e., the generation of all the efficacy and the safety data that will be required to move to clinics. We recently passed a very important milestone with the completion of a first preclinical package that allowed us to designate what will become our clinical candidate. So basically, the formulation of the nanoparticle that will be used in clinic. So this, what has been recently achieved as part of the collaboration with Michel, and the objective of the next coming month will be to put in place a first clinical trial to evaluate this targeting nanoparticle in patient, and more specifically, we plan to put in place an IIT, an investigator-initiated trial in China, where we will be able to treat about 20 patients, with the first patient treated before the end of next year. So the objective of this IIT is to get the confirmation of the safety, but also to gain the first evidences of the clinical efficacy of our in-vivo CAR-T platform. As mentioned, about 20 patients, and with this first construct that we have elaborated. What is interesting is that the in-vivo field is obviously booming. As you may have read recently, no less than 4 acquisitions took place over the past 6 months, with 3 of them with a value beyond the $1 billion for the acquisition. And what is also very interesting, as you can read here, is that the stage of development where those acquisitions took place are pretty close to the one where we are currently at Alaya, because EsoBiotech, for instance, got acquired by AstraZeneca for $1 billion, and they only had 1 patient treated. Likewise for Orbital, which was recently acquired for $1.5 billion, only based on IND-enabling studies, i.e. preclinical data. So based on this obviously very dynamic environment, M&A environment, but also on those promising preclinical data that we recently obtained, we signed a term sheet with new investor for $10 million, which pushed us to recently announce the closing of the crowdfunding campaign with Capital Cell. So you only have a few days left. I don't know if it is on Thursday at midnight or Friday morning, but only 1 or 2 days to join this venture together with us and to be part of the future of in vivo CAR-T.